Hello cutie pies! Today let's play Maple Hospital. Today we have our patient Henry who needs ICU. First let's check. So he is having a stroke. So for stroke patients in ICU, today I am going to show you how to treat them. Come. First, you have to take this thermal tube, then attach it to the patient. Then use the EKG and attach it to the patient. Then take a saline IV and attach it to the patient. Then use the EEG and attach it to the patient. Now, once you have done that, check your current task. Attach the bag to the side of the bed. If you get like this glitch, then the system might have skipped one part. So first you have to go outside, then go to the break room. Once you are at the break room, go to the supply room, the ICU supply room. Then take this catheter bags here, then take it to the patient room. After you have taken to the patient room, you attach the catheter. Then you check your current task. Then you will get this. So the computer is right here. This machine is the computer. Now you will want to write in the notes whatever you have done. Then you will get this doctor orders. Treatment history is the treatment which you got before. Now you will want to take a blood sample. Now if it says blood sample, you have to go to the break room again and go to the ICU supply room. After you are here, you have to grab this blood samples. If it says swab sample, you have to take your swab. If it says urine sample, you have to take these bottles. Now take your bottle to your patient. Then find a glove where you can keep your gloves and then draw blood out of your patient. After you draw the blood, you have to take this blood outside and find the tube system. If you can't find it, like me, you just have to come here, press on move capsule, then add item to the capsule. Now you will want to go back to your patient room and wait until you get your lab results. But before that, you have to remove your gloves in the trash can. The trash can is outside here, and you have to remove it here. After you've done that, go to the supply room nearby, then go to the break room here. Then you will see restroom. Come here, use the sink and wash your hands. After, you go back to your patient room and wait. Once you get a message that the lab has received your sample and will have the result shortly, then you have to wait for the results. And my patient here should wait until he gets his lab results. And once he do, you'll get a pop-up message like this. Accepted. Check your current task and let the patient rest for a while. Then when you check heart rate, take this stethoscope from your inventory and check his heart rate. Now use the computer to sign in for his heart rate. Then check the pellet pulse in the right foot. Just after press check pulse. Then you have to press on check reflexes. And then you have to check this shiny pen. Use the computer again to write the notes. Now go to here, wherever you can find the table. Then take this to eat. Then put on your gloves again. Then swab the patient's mouth. Now then take his temperature. Then use the computer to write his temperature down. Now continue to monitor the patient. Now your patient had regained the consciousness. Monitor his vitals. Meaning you have to monitor him because he had got consciousness. Now you have to transfer your patient. Now you have to wait for the nurse to come and transfer the patient. I don't know where he is taking him, but I also don't know where he's going to take him. So you definitely don't want to try because he will go back home or somewhere. But we will definitely not find him ever again. Bye.